Hey, everyone. Hey, it's Dr. Tamara Beckford with Your Caring Docs, dropping all the health and wellness info for you so that you can feel empowered and take an active part in your health and wellness life. And in our special segment of Your Caring Docs, Docs Who Care, we're pulling out all the gems from all over the world. We have docs who are bringing you all this great info on health and wellness, right? The best part is that they're going to leave all of their contact info here so you can get in contact with them if you want to be part of their team or if you would love to be a patient of theirs, right? Today, we're about to bring in a warrior survivor and all around bad, shut your mouth. That's right. We're talking about Dr. Kordai DeCoteau. She's representing from Florida, but right now she's in the Northeast. Okay, so all your Florida folks, go ahead, give her all a shout out.
305, 954 all day.
Okay, now all the Northeast New York. That's right. All the Northeast people. Now you could give her your shout out. Okay, Northern New Jersey, New York, and all of that.
New York City, Bronx, Brooklyn.
Everything, right? So I'm going to drop a little gem on you, on her background, but she's going to let us know it all, right? So Dr. DeCoteau, she went to podiatric school at the New York College of Podiatric Medicine, right? Then she did residency at St. Barnabas in the Bronx. She's currently a podiatrist in Northern New Jersey, working at the Heart Center of the Oranges, which is a multidisciplinary group, right? There, she's taking care of all of her patients' needs, surgical, in hospital, and so on. Not only is she all of that and a bag of chips, but she's also a cancer survivor. So Dr. DeCoteau is a breast cancer survivor. Today, she's going to tell us all about not just how she takes care of her patients, but how she takes care of herself and her journey through being a survivor of breast cancer. I tell you, we have only warriors up in this piece. Dr. DeCoteau, hey. Woo!
Hi, everybody.
Hello. All righty. So we're going to try to get into the diabetic foot care arena, right? Now, it's very important. We know that there are tons of people with diabetes, but I don't think that they realize how important podiatric and foot care is as a part of their wellness, right? So go ahead, drop the gem on them. All right, let us know.
Absolutely. Thank you so much, Dr. Beckford, for having me. What can I tell you? Diabetic foot is a conundrum. A lot of times people are at risk for diabetes, don't even know they're diabetic, as Dr. Beckford knows. So a lot of times there's late diagnoses. What happens is that excess sugar that your body cannot process can damage some of the nerves in your feet, and that can lead to something called diabetic neuropathy, which is pins, tingling, itching, burning. Actually, Cedric the Entertainer has been a big proponent for diabetes about getting people appropriately examined and treated because his father had that, and I believe had some complications with diabetic neuropathy and amputation.
Right.
Also, you can get microvascular disease, which happens with the concurrent of having high blood pressure or hypertension. And so now you have the little vessels in your feet and in your hands that don't get blood flow. Now triple that if you're a smoker. It doesn't matter what you smoke, it's the actual burning of something that's the issue. That can cause a lack of blood flow to those areas. Hence, you have patients who have now an area that's not well protected because they are neuropathic, an area that's more prone to having vascular conditions, which then can lead to infections such as ulcers and sometimes even gangrene, which requires automatic surgical intervention. So my goal is to make sure that we catch these things early, to give you, being in a multidisciplinary group like the Heart Center of the Oranges, we have a wonderful nutritionist in our group, paired up with our internal medicine physicians. We even have a neurologist in our group and pulmonologist. So having that is a great team, and also referring out to my colleagues and friends who I know who do the variety of treatments depending on what the diabetic patient may need. So it's a whole disciplinary team that gets our diabetic patient on point.
Right. So we've just talked about with having diabetes that you can have this term, we use neuropathy. So neuropathy, the nerve endings, right, to that area, it's now Yeah, it's either damaged or it's gone. So you're not, if it's being damaged, that's the pins and needles. You're like, each time I put my foot down, it's like I'm walking on pins and needles,
Pins and
right?
needles, exactly.
Right, absolutely. And then you might even have the, okay, well, now you just don't even feel yourself walking because now that whole nerve is gone. Now, one of the things that with diabetic patients is you have some patients who are diabetic and they might not be that far along. And
Correct.
so they think that everything's fine. You just got diagnosed with diabetes. You're probably a year or 2 years into being a diabetic. Let's inform those patients how important it is for them to be seen and to ensure that they're having wonderful foot care, right? So let's
Correct.
mhm. So
So I tell patients that even being pre-diabetic, that's that range
oh,
where you could turn to diabetes or you could not. Is important to be seen.
mhm,
Everybody needs a baseline. Baseline with your doctor lets us know this is where you live, this is where your standard. So if you go awry, we are your best advocates to know, is there something wrong? How wrong is it? How we can address or fix it.
mhm,
Pre-diabetes is usually 5.7 to 6.4. That's that test that they do, which is called your hemoglobin A1C. You
mhm.
cannot cheat it in any form or fashion. That is why when patients come in and they might be diabetic, checking your blood sugar, and we check it in the office and it's perfect at 80 or 90, I don't really care. That's great for today. I want to know what your hemoglobin A1C is. That is a determinant factor of if you will get those things that we talked about, particularly
Mhm,
diabetic neuropathy. Some patients can go and have a very high hemoglobin A1C, nines and tens, and not have many symptoms. Some
mhm,
people, which the goal for diabetic is to be under 7, diabetes is 6.5 to 7 milligrams per deciliter, which is your hemoglobin A1C. Sometimes even that being at the high range of that can have patients having symptoms. So it's
mhm.
all in how your body works. Everybody's an individual. Just because your cousin didn't have it doesn't mean you won't, and vice versa. So
Absolutely.
the things that we tell patients, what we do, we bring you in the office, we check to see if there's any lesions, calluses, what have you. We also check for your sensation, where we're using something called a Semmes-Weinstein monofilament. A little monofilament, it looks like a little plastic wire to see with your eyes closed, what can you feel?
Mhm,
Sometimes we'll percuss or palpate or hit the nerve to see if you have any pain or tingling that goes up and down your feet or into your legs.
mhm,
That lets us know what's going on with you as well. In addition to your labs, how well are you doing? What's your kidney function? So all of those things that doctors, some patients hate doing the blood work is important.
right.
If you have neuropathy, what can we do? There's
Mhm,
various stages. The mild stages, you may say, I feel occasional numbness and tingling.
mhm.
Sometimes you can use a topical called capsaicin, which is a hot pepper for us West Indians.
It's cayenne pepper for all y'all who trying to figure it out.
Which is in a compound that you can apply to the foot. Sometimes the side effects can be flushing or even irritation or burning, but it is a great option. Um, Sometimes there's compound companies that your doctor will use, which will put a combination of topicals such as capsaicin, gabapentin, which we'll get into in a second, and other things, lidocaine, to give you some relief.
Mm,
Latter stages usually will be anything from the anticonvulsants, such as gabapentin, Lyrica. One of the things with Lyrica that people don't like is that it can cause swelling in the extremities. So if you tell me that you swell or you have venous insufficiency, varicose veins, or you have COPD, or you have any kind of heart problem, you're not getting Lyrica. Gabapentin is also a titratable medication, which means that we start you in a baby dose and we bring you up. The
mm,
frustration is that it's not always explained well, or patients are expecting an automatic, some
yeah.
patients will get it at a low dose. Other patients, we're bringing them up. We don't want to put you on it too strongly because of side effects, and you might get dizzy and how your body reacts. So we're trying to make sure that we get to a level where you say, Doc, I went from feeling pain wise an 8 out of 10 to now a 2 out of 10, and
Mm,
you're happy and can live there. As I tell patients, no matter what, these are treatments. There's TENS units that people use as well, and physical therapy, which are adjunct treatments to help with the medications that we give for neuropathy. But nothing beats a good diet. Just like a lot of us are trying to lose weight. I know Dr. Beckford, you and I are always talking about that.
yeah.
It's the eating. 80% is your diet. That 20 is your exercise. So getting your blood sugar into a healthy range, using your primary care doctor and your specialist, like the podiatrist, your endocrinologist, which is a fabulous tool to make sure that you are using the appropriate medications and those fields, and having a good nutritionist to guide you along the way of how to eat.
Mm-hmm. So have you seen that patients who've had neuropathy and have improved their diet, that they've also had some lessening of these symptoms?
Absolutely. Now, there's neuropathy that can be permanent, and that, unfortunately, it is what it is. But
Mhm.
sometimes we get patients in the beginning stages, and they're really committed to a change in their lifestyle. I've had patients either reduce the amount of medication they need to take. We may go from 600 milligrams twice a day to 600 milligrams once a day, which is a big improvement for them.
Mhm.
Or 300 milligrams, they don't need that anymore. And I've had a couple of patients actually come off of those medications. Again, early stages where they didn't have permanent neuropathy. Once
Mhm.
it's a permanent thing, its permanence is hard, it's
It's
virtually impossible to
Mhm.
reverse, and hence we continue the medications accordingly.
Okay, wonderful, wonderful. Lots of gems. Now, there's some people who are there and they're like, well, I don't know if I need to go to the podiatrist because I get my feet done and I know my feet look good and blah, 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 and da, 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 da. So now let's inform those people. Now, because you're going to get your feet done, you did not get an exam. Let us
Absolutely.
know.
Absolutely. So yeah, I'm a woman. I enjoy getting my feet done too. But one of the things that, particularly as being a diabetic and even being a non-diabetic, they're not physicians. We were doing a comprehensive exam, musculoskeletal, to see why you're forming calluses and blisters. Blisters are friction. Corns are because you have a problem with the bone or joint. And unless that's addressed, usually either biomechanically by changing the way you walk with our custom orthotics, padding and strapping for those who cannot or do not wish to have surgery, and ultimately surgery to correct your deformity. Your pedicurist can't do that. Addressing ingrown nails. Just because they clip it doesn't mean the ingrown nail is gone. The nail actually grows all the way to this area down here, which is impossible to get without anesthesia. And
Mm.
also a treatment called a phenol alcohol procedure, which gives you a high rate of non-recurrence, it not coming back. Looking for any types of sores or ulcerations. You may have a little cut that you think is no big deal, and your pedicurist is now using the pumice or whatever they use, and it opens up into a full-blown infection.
Mm.
Also, fungus. Fungus is a big thing. Everybody's getting their nails done, and I'm seeing everybody trying to have a hot girl or a hot boy summer, and I'm seeing the
Okay.
most horrible nails I've ever seen because
Mhm.
they're infected. So a lot of it is you should see, even if you're not a diabetic, if there's any concerns ever, you should see your doctor. Have it as a baseline. As a
Mhm.
diabetic, usually we're seeing you every 9 weeks to 12 weeks. And
Yeah.
that, and sometimes sooner if there's an active chronic problem or an acute problem that must be solved. That is why you should see your podiatrist.
Absolutely. You hear that? If you're diabetic every 9 weeks or so, you need to be going there and getting checked, right? So you're not going to go with your nice pedicure and getting all that. Well, everybody's seen Martin, right? So when Martin is getting that thing done, you do not want any of that. Exactly, right? And then you next thing you know, you're causing worsening symptoms. This small cut is now becoming ulcer that's deeper down to the bone, that's now infected the bone, and boom, we moved on. Gangrene, you're having this discharge, that smell, and so on. Now, let's also keep in mind that we know that where some people who they have discharges and so on in their feet and so on, because the feet is an area that's covered, they don't want to divulge that info to like their family, or so I don't want to bother family members. Keep in mind that our feet are important, right? It helps us to move along. So getting an evaluation by your podiatrist if you're having cuts or issues on your feet is an important part of your health, right? Once that gets beyond a certain point and you're getting amputation, that's it.
Right?
So
Absolutely.
it's very important. Alrighty, so now I know you're there and you take care of all these people, and I mean, like, you are killing it over there,
Thank you.
aka colloquially speaking, taking care of a lot of people, right? But then you had within yourself, when you became a patient, right, the tables turned on you.
Tables turned.
Yes. So walk us through your experience and what happened to you as you found out about the infamous breast cancer.
So I was diagnosed with stage 2, HER2, PR weakly positive. I know it's a whole lot. Breast cancer. Breast cancer is usually looked at as the HER gene, or protein, I should say, estrogen and progesterone that sits on the breast cancer cells. And that was my diagnosis. I was quite shocked. I've had a history of a non-cancerous lesion or mass called a fibroadenoma, which is quite common in menstruating women. A lot of women of color tend to be highly prone to this, as we have more fibrodense breast. One of the best things that were done because I had that was that I had mammograms at a much earlier age, starting at 35 versus 40, and ultrasounds from that time that I was had my first non-cancerous mass at 16. I do not have a history of breast cancer in my family. After being diagnosed on December 3rd, 2019, I had genetic testing, as all breast cancer patients have, and it was completely clear. Being a patient, had some of my colleagues weepy. Obviously, it was a blow for me, and I didn't have time to mourn as much. I was blessed, which is why I have a breast cancer advocacy, Talks with Dr. D, on all my social media handles, LinkedIn, Facebook, Instagram, and YouTube. And it chronicles my journey. It's interviewed people who benefit the breast cancer community. But Talks with Dr. D is all things health, wellness, and beauty for people with breast cancer, their caregivers, and those who are affected by it. So I speak on podcasts like this. I interview people myself. I talk about some of the treatments I go through and have people respond back. I'm deeply integrated into local breast cancer, or international ones actually, across the country, such as Touch Black Breast Cancer Alliance. That's something that's dear to my heart. Cancer Wellness Magazine, which I was featured in, talking about how I try to create beauty with breast cancer, because cancer can be ugly, but you can make it so beautiful. Right. And being on the other side was hard, but I was blessed again in my journey where my colleagues were my treatment team. So it was not like I didn't know who was treating me. My oncologist is a colleague and a friend. My hematologist oncologist is a dear friend. My OBGYN, I'm the godmother to her youngest. My surgeon was a colleague of my OBGYN, and now we're friends. Interventional radiologist and I became friends, and it made it much easier because I felt like I had a team rooting for me, Team DeCoteau, and everybody was, getting into their positions to make sure we won. And so I am proud to say that as Dr. Beckford got to celebrate with me, that I was cancer-free technically when I had my surgery, a lumpectomy, which is removal of the mass, last May 2020, and then clean bills of health ever since, with ultrasound and mammogram and MRI, which are spaced accordingly by my doctor. All I can say is too much is given, much is required, and hence Talks with Dr. D was born back in 2020, and we'll keep going until we can't go anymore.
Oh, absolutely. Now, with you being on the other side, how can you say, and how do you feel that it has made you, when now you're a doctor or you're going back taking care of patients, have you found yourself being a little bit different? Your empathy level, everything.
Yeah, I think that as doctors, because we're trained to cure, fix. Sometimes we lose our empathy. Surgeons are worse because I do surgery as well. We're like, find it, fix it, take it out, make it better. It's made me definitely respect my colleagues more. I mean, physicians, they go through a whole lot. And when it's somebody personal to them, it's even deeper, because not that everybody matters, clearly, but your colleague who's fighting with you to get patients to live their best lives now is affected. Part of the team is down. That's what they look at it as.
Right.
I probably, had some difficulties, just trying to accept being a patient. That's why I didn't do that well in one of the hospitals that I have privileges with. I am on 3. I did it at a hospital that did not know me, but my colleagues did, which was better for the anonymity and some peace. It made me look up a lot of information. It made me question a lot of information. I didn't care if they were my colleagues. I got a second opinion from Sloan Kettering, which matched what my colleagues said, because I was fighting for my life. And I would tell patients, anytime you are in doubt or have questions, always get a second opinion. A competent doctor is never going to feel like that's a slight on them. If they're good at what they do, they will encourage it, because the whole point is for the patient to have the best information and the best team they can to, fight, solve whatever problem they have, particularly when it comes to cancer.
Absolutely. Absolutely. So I told you guys, we only have the best. Y'all thought I was kidding. So not only do we have Dr. DeCoteau, she's taking care of patients, but she also fought for her life and the things that she won. And through that journey, she started a whole foundation, a whole new platform for those who are also going through this, right? And she started the Talks with Dr. D, for where she has a podcast. Are you doing a podcast soon? She has
So I'm not sure. I'm sorry, Dr. Beckford. What I would say is, so I'm on LinkedIn, I'm on Instagram, so what we have, and Facebook and YouTube. And so what we do is a weekday, it's called the Weekday Hustle, where I may be talking about, for example, a topic that will come up soon is medicinal marijuana. And I give you tidbits of what my thoughts are. And then in the weekend, we have what's called the Weekend Kiss, where I get into more deeper things and allow people to email me with questions and comments and what have you. Again, the YouTube that you see are previous interviews with different people, medical specialties. Even one of my friends who runs the Captain Cuties about wearing a captain, particularly post mastectomy or lumpectomy. You feel like crap, might have tubes, special bra, at least you can look beautiful. So just besides the medicinal part of it, you know, what about the beauty part of it? You know, about lashes, you know, for those who lose their eyebrow. My lashes got cut by 75%. I was devastated. And as, you know, simple as and silly as that may sound, when you're used to something in your body and it's not there, it is an emotional issue. You know, so those are the things that my social media covers, and interviews that I have, whether it be with a magazine, whether it be with a podcast such as yourself, so that, you know, my followers and your followers can gain insight on what I'm doing from the breast cancer perspective.
Wonderful, wonderful, wonderful. And as we say, this is Talks with Dr. D, and you can find her on, let him know.
So I'm Talks with Dr. D on all social media. If you type in YouTube, plug me in, Talks with Dr. D, Facebook, Talks with Dr. D, Instagram, Talks with Dr. D, and LinkedIn. I'm going, as you know, Breast Cancer Awareness Month is October. It's going to be a very hot month with a lot of exciting events. I encourage you to follow me. For my breast cancer advocacy, you can always email me at K as in kite, D as in David, styling, the number 18 at gmail.com, Katie Styling Katie Styling 18 at gmail.com. You can contact us, leave comments on our YouTube for anything you like. My website is also Talks with Dr. D. Feel free to peruse, comment. We love it. If you have any breast cancer awareness questions, or are doing something for Breast Cancer Awareness Month, I would love to be a guest or participant with whatever the groups do. And you know that's the same for you, Dr. Beckford. Absolutely. From the professional perspective, as a podiatrist, you can find me at theorangeheartcenter.net, which is the heart center of the oranges, and make an appointment. We'd love to hear from you and to meet all your needs in the North Jersey area. I get patients still from New York who follow me where I used to practice. I thank you guys for that. And, you know, we're here to serve your needs.
Absolutely, absolutely. And all of this information will be provided on our Your Caring Docs, Docs Who Care website. Yes, our special area. I thank Dr. DeCoteau for spending this time with us, enlightening us about podiatric care, especially in the diabetic population, and also enlightening us about her journey as a survivor of breast cancer and all that she has and will be doing for others who are either going through the journey of going through cancer or those who have gone through the journey and are survivors as herself. She has a platform there ready to talk with you, to commiserate, and to also help those who are going along in that journey, right? I am Dr. Beckford with Your Caring Docs, and that is URCARINGDOCS. And you can find us on the different platforms, on Instagram, on Facebook, on LinkedIn, on Twitter, on IG. Yes, and also do not forget, you can find us at www.URCARINGDOCS.com. That's our Your Caring Docs website, where we'll be featuring all of this great info that you heard here today, along with Dr. DeCoteau.
Thank you so much for having me. Everyone have a wonderful, wonderful weekend.
Absolutely. Thank you. Bye.
Bye-bye.